Did you know that snoring is not normal? And it's something that you should just live with? Really? I don't think so. Hi there, I'm Dr. Holly Donahue, and I am known as the Root Cause Doctor. And today I am going to show you, I'm going to attempt to, but I think I'm pretty good at this, show you how to stop snoring naturally so that you can finally get that deep REM sleep and sleep soundly each and every night. Because when you fix the real reason that you're snoring, you don't just stop all that noise, you actually protect your heart, your brain, and your overall health. Because when you sleep deeply, that's when you truly heal. So nearly 2 decades, I have been helping patients uncover the true root causes of their symptoms, the ones that other doctors often miss because they're focused on just that system. I've guided hundreds of people out of chronic illness, exhaustion, decreased bloating, weight loss, and yours truly, while you're listening, sleepless nights, even when they're told that they just have to live with it. How many of that is you? It was me back when I was a teenager. You just have to deal with it because there's nothing wrong with you. And snoring, it's one of those hidden signs that your body is waving at you saying, there's something wrong, please fix me. Snoring happens when the muscles in your mouth and in your nose and your throat relax too much during sleep. That begins to narrow your airways and cause tissue vibrations. And that's the sound that we're actually hearing, whether it's yourself or somebody else snoring. It's more than just an annoyance. Snoring can signal deeper health problems like obstructive sleep apnea. Who's heard of that? It seems to be being diagnosed all the time now. I never saw patients with it, and now I see it all the time. So obstructive sleep apnea increases your risk for heart disease, memory loss, and even hormonal imbalances. It affects 50% of men, I would say 57% of men, and 40% of women. And even now, we're seeing it happen in children. So it's happening in your home. It's time to take this seriously. Snoring can be triggered by extra weight around the neck, alcohol, drinking alcohol close to bedtime, smoking, nasal issues like deviated septum, sleeping on your back, or even pregnancy. So with a pregnancy, the snoring is often short term. These aren't just snoring causes, they're actually health flags that deserve more attention. So how about if we talk about how to stop snoring naturally and sleep more soundly is really what I wanted to say. Lose a little extra weight. Even 5% of weight can cause notable differences in snoring frequency and volume, because when you lay down at night, right, this neck, this area can't allow that patent airway to open. Quit smoking, and if you're not going to quit smoking, at least don't do it before bed, because smoking can irritate and inflame your airway, and then again, that's going to narrow your breathing space at night. Avoid alcohol in the evening. People believe that alcohol allows them to sleep more soundly, but it doesn't. It relaxes your throat muscles, and not only the sugar and the alcohol, but it actually disrupts your sleep cycles, and the sugar could cause you to wake up as well if you have imbalanced blood sugar, but we're talking more about airways here. But before we go into the snoring solutions, I want to give you something that can transform your life that I've been working with patients at my clinic every single week and month. And I work with them and created this program called the Holistic Sleep Solution, where I take them through a 5-week reset that helps them uncover and address that reason that you're not sleeping deeply. And so this is why I created it for you. Whether it's snoring or hormone imbalance or or changing up your room because it's got all these electronics in it, or chronic pain, or even stress, this holistic sleep solution program will teach you how to get restorative, healthy, healing sleep every single night. Click the link in the description to download it and start sleeping soundly naturally. All right, let's go back. Review nighttime medications. Some muscle relaxants taken too close to bedtime can truly make snoring worse. So talk to your doctor before you make changes, but be aware of that and ask questions about your medication. Change your sleep position. How are you sleeping? Are you sleeping on your side? Are you sleeping on your back? If you sleep on your side or elevate your torso, this can keep your airway more open. And be aware of what pillows you're sleeping on that will allow you to get a little bit more elevated in your torso. Most people, ready for this, don't change their pillows for 20 plus years. Reduce nasal congestion. Use a saline rinse. I love Neti pots, a humidifier, and an air purifier to keep your nasal passages clear. The truth is, we don't live in a clean world anymore. As much as we clean our house and things, it can get dusty. So the humidifier and air purifier can really help keep your area clean and allow reduce of nasal congestion. And then you can actually try anti-snoring devices. These include like mandibular devices, tongue retainers, nasal dilators. If you're apnea free, you could do mouth taping, and I've also heard of nose taping as well. So if you snore, or the person that you sleep with snores, get screened for sleep apnea. It's easy, you can do it from home. Talk to your doctor. You're often referred to a neurologist, and it could protect you from heart, brain, and overall health. Remember that snoring is a message again to your body, and this is what I'm trying to hit home with all of you. Your body is amazing, and it's giving you signals, but you may be ignoring it, and don't hit snooze on it. So again, I'm Dr. Holly Donahue, and I'm really here to help you fix your sleep at the source, at the root of what's causing it. I really, truly, from the bottom of my heart, hope you found this video helpful. Give it a thumbs up, share it with your friends and family who are suffering from snoring, and I will see you in the next video. I am sending you so much love and deep sound sleep.